Today we're talking about something extremely important that many people ignore until it becomes serious: the early warning signs of mouth cancer. Oral cancer does not always start with severe pain. In fact, in many cases, it begins quietly. That is why awareness is so powerful. The earlier it is detected, the better the chances of successful treatment. So in this video, I'm going to walk you through 7 warning signs you should never ignore. Let's start with the first and most common sign: a sore in the mouth that does not heal within 2 to 3 weeks. We all bite our cheeks sometimes. We get ulcers. We get small injuries from hot food. Normally, these heal quickly. But if you notice a sore on your lips, tongue, gums, or inside your cheeks that stays there for weeks, bleeds easily, or keeps coming back in the same spot, that is a red flag. Even if it does not hurt, it needs to be examined. The second warning sign is unusual red or white patches inside the mouth. These patches may appear on the tongue, the inner cheeks, the roof of the mouth, or the gums. They cannot be scraped off easily. While not all patches are cancerous, some can be precancerous, meaning they have the potential to turn into cancer over time. If you ever notice a persistent red or white area that looks different from the surrounding tissue, do not ignore it. The third sign is persistent pain, tingling, or numbness in the mouth or lips. A strange sensation that does not go away could indicate that something is affecting the nerves in that area. Some people describe it as a burning feeling, others as partial numbness. If the sensation lasts and has no obvious cause, it deserves medical attention. The fourth warning sign involves difficulty chewing, swallowing, or speaking. If you suddenly feel discomfort when eating, or it feels like something is stuck in your throat, or your voice becomes hoarse without a cold or infection, this could be a sign that something is interfering with normal mouth and throat function. Changes in speech or swallowing that persist should never be brushed aside. The fifth sign is loose teeth without gum disease or injury. Teeth do not just become loose for no reason. If you notice a tooth shifting or becoming unstable, especially if your gums otherwise seem healthy, it could be due to changes in the underlying bone or tissue. Similarly, if your dentures suddenly stop fitting properly, this may be a sign that something has changed in the jaw structure. The sixth warning sign is persistent ear or jaw pain. Many people assume ear pain always means an ear infection. However, the nerves in the head and neck are closely connected. Sometimes, a problem in the mouth can cause pain that feels like it is coming from the ear. If the pain is ongoing, especially on one side, and there is no clear explanation, it should be evaluated. The seventh and very important sign is any lump, thickening, or swelling in the mouth, jaw, or neck. Not all lumps are painful. In fact, early cancerous growths can be completely painless. If you feel a bump that lasts more than 2 weeks or notice swelling that does not go down, get it checked by a healthcare professional. Here is something very important to understand. Many early symptoms of mouth cancer look harmless. They can resemble minor irritation, a small ulcer, or simple inflammation. The key difference is persistence. If something in your mouth does not heal or return to normal within 2 weeks, it is time to take it seriously. Regular dental checkups play a huge role in early detection. Dentists are trained to spot suspicious changes before you even notice symptoms. That is why routine oral exams are not just about cavities. They can actually save lives. If you smoke, use tobacco in any form, drink alcohol heavily, or have a history of HPV infection, your risk is higher. In those cases, being extra vigilant is even more important. The goal of this video is not to scare you. It is to empower you. Awareness gives you control. When you know what to look for, you can act early. And early action makes all the difference. Take a few minutes every month to check your mouth in the mirror under good lighting. Look at your tongue, gums, cheeks, and the roof of your mouth. If something looks unusual and does not improve, do not wait. Your health is worth paying attention to. If you found this information helpful, make sure to share it with someone you care about. It could truly make a life-saving difference. Stay informed, stay proactive, and I will see you in the next video.